If you want to understand how we diagnose 21-hydroxylase deficiency, you have to understand one key idea. This is not just a lab test. This is a blocked pathway. 21-hydroxylase is an enzyme in the adrenal gland that is responsible for converting 17-hydroxyprogesterone into cortisol. When that enzyme is deficient, cortisol production drops and the body compensates by increasing ACTH. That drives the pathway harder, and what happens upstream is accumulation of 17-hydroxyprogesterone, which then gets shunted into androgen production. So the entire diagnosis hinges on measuring one molecule, 17-hydroxyprogesterone. The first step is a simple blood test ideally drawn at 8 a.m. If that level is low, under about 200, you can essentially rule the diagnosis out. If it is clearly elevated above 800 to 1,000, that is highly suggestive. And if it is extremely high in the thousands, that is classic congenital adrenal hyperplasia. But here is where it gets clinically interesting. Most patients fall into the gray zone. If the level is between 200 and 800, you cannot make the diagnosis from a baseline lab. That is where the ACTH stimulation test comes in. We give synthetic ACTH, typically cosentropin, and then remeasure 17-hydroxyprogesterone at 30 to 60 minutes. If that level rises above about 1,000, that confirms non-classic 21-hydroxylase deficiency. This is a dynamic test. You are not just measuring a number, you are testing the capacity of the adrenal gland under stress. Clinically, this matters because these patients are often misdiagnosed. Women may be labeled as having PCOS with hirsutism or irregular cycles. Men may present more subtly, sometimes with infertility or unexplained androgen defects. And here is the key takeaway. If you do not think about this diagnosis, you will miss it. But if you understand the pathway and use 17-hydroxyprogesterone correctly, the diagnosis becomes very straightforward. That is how you diagnose 21-hydroxylase deficiency. I'm Dr. Clifford Gluck. Thank you for watching, and please share these videos. I'll see you again next time.